Leanne's still in the waiting room?
Lowell just said that he's in.
Okay. All right, well, we are being recorded and streamed on Facebook, so we will go ahead and get started. My name is Dr. Ruth Bush. My co-moderator, Dr. Sarah Oneida, is on call and being a fabulous surgeon. So I will go ahead and welcome you to this Saturday's Vein and Lymphatic University on behalf of its creators, Dr. Victor Kanata and Dr. Lowell Kabnick. They, along with our generous sponsors, Medtronic and Boston Scientific, have held monthly seminars for the past year. It's entitled EmPowHER. We've had many women who are venous and lymphatic experts and leaders in their discipline. We are closing out this very successful first year with three women who I have known for a while and admire all of them. We have Dr. Kellie Brown, Dr. Erica Mitchell, and Dr. Kathleen Ozsvath. So anyone who is listening, please feel free to put any questions in the Q&A or in the chat. Prior to starting out with my questions is Dr. Kathleen Ozsvath is going to be leading the second year with Vein and Lymphatic University. And Kathleen, would you like to say a couple of words?
First of all, I want to say thank you, Ruth, for doing such an amazing job with this. It's been really wonderful for us all to have a way to get together, and Lowell and Leanne, who were just did such an incredible job. We're continuing with another series we're thinking about as Empower All, and what it will be is it'll be for patients to be able, and non-physicians, non-providers, to get on and just hear about venous disease and what they should expect when they go to an appointment and so on. So more to come on that. And again, thank you, Ruth, for including me today.
Awesome. Well, we will keep this about to an hour and try to be done by 11 o'clock Central, 12 o'clock Eastern, so you all can enjoy your weekend or enjoy being on call. So all of you have been tremendous role models, and many of us, look up to you. You've mentored many young men and women. So what would you say is the leadership characteristic that has been most important to you, that has really helped you achieve some of your goals? Anybody can start.
Well, I'll start. I would say that probably the quality that's helped me through the most in my career is the ability to put yourself in someone else's shoes, kind of that emotional intelligence, the ability to understand where someone else is coming from. So whether it be in a mentorship position where you're trying to understand or remember what it was like to be in those shoes at the beginning of your career, or whether it be in leadership and trying to understand even relationships that are perhaps a little bit tense, understanding where the other person's coming from and being able to negotiate the situation with a thoughtful with being thoughtful about where that person's coming from, I think has been probably the most important thing.
Thank you, Dr. Brown. Dr. Mitchell, Dr. Ozsvath?
I would echo what Kellie says. Certainly empathy and putting oneself in, or just understanding that we've all been there, or especially when you're with trainees or younger faculty, understand where they are in their life and career right now. But I'd also say, surrounding yourself with people with common interests and sort of engaging in a positive energy that we're all in this together, and that we love what we do. And while sometimes things get hard, we have chosen this field especially because we believe in it, and we believe in the people that surround us, and we believe that we're honestly doing what we do is for the patient.
I agree completely. I think another thing I really strongly believe in, that you just mentioned is the importance of a team approach. I can't do what I do alone. And without the incredible support of nursing staff, everybody, other colleagues, our APPs, the secretaries that make the appointments, they're all part of the team. And not everybody has the same educational background or understanding of medicine or whatever that it may be, but each person is extremely important. And what I find is that I'm especially now when I look back kind of on everything in my career, I can't thank those people enough. And I think it's really important to voice that. When someone does a good job, tell them so. If somebody isn't like performing at their best, pulling them aside and trying to understand where they are and what's going on is really helpful. And then they feel supported. But yes.
I think that's incredibly important. I appreciate what all of you all said. And one thing that I've come to appreciate is that public acknowledgement.
Yeah.
So, it's one thing for people, because we've all experienced it, right? Somebody says, oh, you're doing a great job, behind closed doors. But saying so in front of their peers, whether it's your scrub tech or circulator or whoever, you may have different ideas, different, opinions on other stuff that really has nothing to do with your patient care, but publicly acknowledging when they do a good job. So I appreciate that. So you all described characteristics and things that you appreciate at work and in patient care. What about on the home front? What about on the non-work front?
Yeah, I think for me, my husband, I'm married. I don't have any children. My husband is not in medicine, and he doesn't want to be in medicine. In other words, he doesn't want, the gory details of what I did that day are not welcome at the dinner table. So that's good because it keeps me grounded in a way that if I were in the medical world 24/7, it would be a little bit harder. But it's a little challenging too, because if I've been in the OR all day, what do I have to talk about when I get home other than being in the OR all day? So it's both good and bad, but I do think, again, that ability to understand, kind of where he's coming from and understand, trying to communicate. Like one of my challenges is communicating, especially my schedule, because it changes. And I don't know necessarily at the beginning of the day when my day is going to end. And that's been a little bit hard for him to understand as a non-medical person who worked a set of hours for his whole career. So trying to make sure that I communicate throughout the day, here's how things are going, and saying out loud what's going on in my head, and making sure that he understands it. I think that's been probably the most important thing for me to learn. And quite honestly, I'm still learning it. I make mistakes all the time on that, where I just assume he knows something and he doesn't, because I didn't explicitly explain it. And he doesn't do conferences. He doesn't do medicine. He doesn't understand a lot of what it is that I do. So.
I've only been married 5 years to my husband, John, and we have a lovely time together. I'd say one of the things we try to focus on is making dinner together at night, even if it's 10 o'clock, sometimes later. So we do sort of make time for ourselves, but it's same as you, Kellie. John doesn't want to hear anything about the gory details of work and doesn't want to see pictures or anything. He's just like, no. Yeah. But we have things together that we enjoy, and I would say it's art, it's travel, and of course, because he's a fisherman, we incorporate fishing in every single vacation, because it's sort of our time to do things that he enjoys, because a lot of our time at home is focused on my work. So it's sort of a mutual give and take every day, and we sort of embrace the moment, because there are not that many moments in the day or the week or the year. So we try to make the most of what little we have together.
That's great advice. That's
that is great.
I agree. I should have talked to you guys a few years ago. I'm divorced, and my ex-husband is a physician, a very good physician for that matter. but I think his biggest complaint about me, well, he had lots of complaints, but one of the complaints about me he had was that I didn't discuss what happened at work. So he would, just like what you guys are describing, like he didn't really understand, even though he was he is a doctor, he didn't really understand what it's like to be a vascular surgeon, and certainly didn't know what it meant to be a female vascular surgeon. And when I would come home, many times I would just like not want to talk about it. Like I was overwhelmed. I wanted to just sit down, put my feet up, and watch like the Housewives on TV or something like that, just to disengage. And if I look back on that communication is so important in a relationship, and I failed at that, and I will take full responsibility for that. I'm still better off, the way I am presently, but it is a very important thing. If there's somebody that's close to you, you've got to communicate however it works best for you. In Kellie's case, maybe it doesn't work to sit and talk about the really cool case she did, but maybe Erica, in your case, it does, or Ruth, it does for you. So you got to figure out what works, but communication definitely is key. I did a thoracobiphebral bypass the other day, which I haven't done in a long time. And it really was so fun. And I remember,
that's awesome.
Yeah, and the guy's doing great. I saw him this morning on rounds. And it really made me happy because it was a case I haven't done in a long time. It's not one we do often. So on the drive home, I picked up the phone and I called my daughter, who has no interest in medicine, doesn't want to know anything about medicine. I'm like, honey, guess what I did? And she's like, Mommy, that's so cool. She had no idea what it was. That felt good. So I don't know. Sometimes it is good to air what you've done during the day so that the people around you can be, happy for you if you've done something cool that day.
Yeah. Yeah, I think that's true. I do think there's some challenges being a female surgeon, because just with the social expectations of what men and women are supposed to do, and that's getting better over time, certainly. But I do think it's challenging. One of my biggest challenges is when I'm at a conference, if I bring my husband, every other guy there, for the most part, is a surgeon. And we're all talking about surgery. And so that's really tough for him it's hard for him. Most of my friends are you guys. Most of my friends are other vascular surgeons. So it's really hard for him to kind of integrate into that. And that's been challenging. But I think Erica's idea of like with every vacation incorporating, something that you enjoy doing together. Well, obviously that's what vacation is, but it's, prioritizing what they want to do, I think is helpful, because pretty much every day, all day is about prioritizing my work, because it just takes, he's retired now. He doesn't work so outside the home. So he has to support me every single day. I need to turn around and support him and provide that break from the monotony of the home stuff.
I think what you all have said is incredibly important, and figuring out how you have a happy home life, whether it's with your husband, with your child, probably not with our mothers or mothers-in-law, but that's, to me, has been a growing process, because I'm like you, Kathleen. I would want to come home, and my husband had to learn that I'm an introvert. So I come home, I need to decompress. I need to watch, HGTV or something, and sit there, maybe have a glass of wine. And he had to learn, I don't talk to you right now. But I also had to learn that he didn't want to hear me rehash it. We tend to talk about, the cool case or the bad things that happened. And so, I think also it's finding someone, a girlfriend. You could have called me about that thoraco. I haven't done one in, it's been over a decade. I'd love to hear about it. Find someone or text them or whatever. I think, we are each other's support, but we also have, someone or in our sphere that is our support system as well. But figuring out that it's not, and you get better at this over time, that it's not always about us. It's not always about us, that it's about them as well. And I've learned, Kellie, that my husband doesn't want to come to these meetings because he doesn't see me. So what we're doing in July is I've got something to do. He's going to come the very last day, and we're going to stay for a day extra. I mean, but we got this. Talk about failing, Kathleen. I failed at this miserably. You know, yes, bring your non medicine husband to something, and then you're gone all day long, and you've got a 7 a.m. meeting, or you know, something even earlier, and you're getting up, and they're like, "Why are you getting up this early?" You know, this is my vacation time. So realizing that for us, it's still work. It's still work, but that you can have a little bit of that. So let me switch gears a little bit. So what's been your biggest challenge in being a leader? Is there a quality that you've had to cultivate, that you're still trying to cultivate? What didn't come naturally to you?
Yeah, so I would say my biggest weak point, my biggest weakness is confrontation, difficult conversations. And obviously as a leader, you have to have those. And I've really had to work hard. I definitely I try to accommodate people. I try to accommodate and meet everybody's expectations of me. I'm very much a people pleaser. You know, that's kind of my baseline nature. So I really have had to work hard to be able to handle those sort of difficult conversations when I'm going to have to make a decision that not everybody's going to like. And I have to be able to justify it, and I have to be able to stick by my guns. And that's really important to do, because a leader has to make the tough decisions. And you can't, unfortunately, it can't always be a democracy. That's not how it all works. So you have to sometimes put your foot down and say, this is what we're going to do. And not everybody's always going to like it. So that's something I've had to work on my whole career, and I'm still working on it.
Do you feel you get more pushback sometimes because you are a woman? More questioning?
In certain situations, certainly. I've definitely, I've been written up once in my life, one time in my however many years I've been doing this. And it was a situation that I believe certainly if I were a man, I would not have been written up. So I think that, I mean, in fact, I've been in rooms where men have said exactly what I've said, and they don't get written up. So I think sometimes expectations of female behavior are different than male behavior. And although I have to say the last 5 or 6 years, we really are talking openly a lot about this stuff. So I think it's getting better because it's not taboo to talk about it. And I never want to assume, I never ever want to assume that something's happening to me because I'm a woman. I try never to go there, because that's just not a beneficial way to view how, something bad is happening to you. You really need to try to figure out why. But I do think that that's happened. I do think sometimes you get that pushback, and you don't always get taken as seriously as you should. For the most part, though, I'm in a great, I've been very lucky not having to deal with that much discrimination. I know others deal with a lot more than I ever have had to deal with.
Indeed, I would say the same. I'm fortunate. I mean, I'm not fortunate. I have chosen a position now where I'm very well supported, and I'm building a practice from nothing. And I would say the easiest part of my day is operating, and bring anything on. I feel very comfortable doing it. But what I've had to realize is that I have to do what I was hired to do, and that's to build this practice. And sometimes the easy thing would be to go to the operating room, and it's sort of saying, you go operate while I deal with all this other work, or this other stressor. And really it's about relationships and communication. And I would say that we are not trained to communicate well, and we are not given, in medical school, residency, fellowship, none of us have been provided any training in leadership, management. Other than the operating room, like, how to lead and empower an operating room, but just the critical, crucial conversations we haven't been prepared for. And I would say that has taken some time for me to understand that this is very important. And fortunately, I have a lot of support from my husband. He worked at Intel for 27 years and was a communications manager. So I have an at-home coach.
That's great.
Yeah, so
I may need to call him.
Yeah.
yes, absolutely. He's amazing in that area. And it's interesting because we haven't been provided or trained. It's not a skill set that we've been trained for.
It's funny. I don't know if it's my own personality or if it's sort of a more female associated thing that we are bad, or I certainly am bad at saying no. Because of that people pleasing thing, you want to be there, you want to, help, when people come to you and they want your help for something, you're like, yes. I was so proud this morning I usually don't turn down things like getting asked to speak or whatever. And I said no today to something.
Woo!
I was like,
how did it feel?
It felt really empowering. So I think that knowing your own limits and what you want to do a good job, and you always want to do your very best. But if you overwhelm yourself, which I'm really good at doing, then that doesn't help anybody. And you might be helpful to others, but it takes a toll on you as a human. And that's something that I work on a daily basis. And I think that, again, in leadership positions, when people are coming to you, you want to just do whatever you can to help. And I'll give you an example. Our anesthesia program fell apart. So we're building a new anesthesia program at my hospital. I'm chief of surgery. So I have to interview everybody. Well, I'm not given administrative time for that. So it's literally like weekends, nights, in between cases, whatever that it may be. So, and we've been very successful. They turn to me and they go, "Oh, would you help out with general surgery recruitment?" I'm like, "Are you kidding me?" So sometimes when you do a good job, they'll ask you for more.
Oh, yes.
And that's a good thing, but it can also, you just have to know your limits. And I got to know my limits. And I have to remind myself of that on a daily basis.
It's multitasking at the crazy steroid level.
Yeah.
Yes,
Yeah.
absolutely.
It is, but I think one thing I've had to learn, and I learned this from Julie Freshlag, is that, I'm in administration, so my patient care is only 15 to 20% of what I do. And I have to say, it is so nice to go into the operating room. My phone is on do not disturb, and because I don't want to hear it bing. Nobody wants to hear it bing. They can find me. And it's delight. But, when you're in administration most of the time, you're available to people all the time, whether it's Teams or Zoom or whatever, chat. And so I learned from her to actually block out time, me time. So and it's not that I go do yoga or something, it's to get anything done. Because, if you've got to sit in front of your desk on a Saturday, Kelly, it's because you didn't have a big enough block of time to actually shift gears, focus, do whatever you need to, because I can't work at home unless my desk is eaten, my laundry's folded, and the dishes are washed and put away. It's just part of my persona. I can't have chaos around me. So I have put in blocks of time, and it's called TTT. I learned that from her, time to think. And whether it's 2 hours or 3 hours, it can't be 15 minutes here or there because you can't refocus. You barely have time to get a drink and go to the ladies' room or whatever. But you really need blocks of time that your assistant, your residents, whoever knows that do not disturb. Basically, is what it is, to get something done, or to just tune out whatever else is going on. So that's sort of how I maintain my sanity throughout the day or the week, and plan those blocks of time ahead of time. It's not many, and I try to be consistent on what days they're on.
I have started blocking my calendar. Like when I say yes to something, I've started putting time on my calendar to do whatever it is I said yes to.
Good idea.
And I'm not 100% yet. I'm not as good at it as I need to get. I just recently started doing this. because you say yes to something, just Kathleen was saying, you say yes to something, but you fail to account for the 10 hours it's going to take you to get whatever that thing was done. And you think, oh, I'll just get it done. I'll get it done whenever. Well, those 10 hours are going to end up being at the expense of time at home with your family or your loved ones. So I've started blocking that out. And if I can't find any time, I have to say no, because it's not, I don't have time, like literally don't have time. And there's exceptions that there's things you're just not going to say no to. But for the most part, that's what I've started doing, because I've gotten to the point where I really had said yes to really too much. And I needed to really account and be realistic, because I'm one of those magical thinkers. Oh, I'll be able to get it done. I'll get it done. Don't worry, I'll get it done. So it's not magic. You have to have time to do it. So that's one thing I've started doing, and hopefully it's helping a little bit, but I'm not as good yet at doing it. I still say yes without doing that, and I need to just like break that habit.
That's actually great advice.
I think that's a personality of a vascular surgeon. John will say, I mean, everything I do, he's like, why are you stuffing 30 pounds in a 5-pound bag? Everything I do is that way. And I think that's sort of the personality of a vascular surgeon. When we overcommit, overextend, over this, overindulge,
Yeah.
That's it's we still go from one thing to the next, to the next, to the next, and that's sort of what we do. But at some point you do have to control it, because it's chaos.
Yeah.
It's funny, what I've noticed, getting back to Kellie's point with getting written up, I have lovely, wonderful male colleagues, partners, whatever. They're wonderful people. They have no problem speaking their mind. And I've noticed that one of them has gotten himself in the hot seat a couple of times, gotten written up, because because of his way of responding when he gets calls from, and I quote, stupid people. And what I notice is that I would get phone calls from these same people asking me a question about somebody in the ER, whatever. And I would just, yes, I was irritated because it was 2 a.m, but I'd be like, but the way I respond to them, I try to be nice. And somewhere in the middle is probably appropriate, meaning that if you're too nice, you're going to get the phone calls when you're not on call, which happens to me all the time, from every ER doc, hospitalist, whatever, because I always answer my phone, even when I shouldn't be. Yet then you've got the opposite of that, who's the guy that they won't call because he's mean and he's not nice. So somewhere in the middle, you've got to come up with where the boundaries are. So if now when I get called from the ER from one particular doctor who calls me every day, I'll say, listen, I'm not on call. Let me give you the phone number of the person who is, instead of just not answering or yelling at him or whatever that it may be. So we have to learn to set boundaries and do it in a way that's kind, but where people understand that this is not the time to call Ozsvath. This is the time to call somebody else.
Mm-hmm.
So both of you, and you alluded to Erica, Kellie, and Kathleen. Kellie, you mentioned, stuff eating into your home life. You mentioned boundaries. So let's shift and talk about work-life balance. It's sort of become, it's been an Oprah Winfrey word since the 90s, but it's one of the things that younger persons, trainees, learners ask. How do you achieve balance in your life? And I always say that the balance changes every day. But how would you all say that? How do you achieve balance? How do you make sure things don't creep in at home? You talked about setting boundaries there at 2 a.m. But maybe what does balance mean to you, and how do you achieve it?
Yeah, I think I don't know that there's balance as much as integration, but I think so. I'm not the best example of it. I'm pretty bad at it, to be honest with you, but getting better. So one thing I've done, I'm a terrible planner. Ever since residency, I've just tried to get through one day at a time. So I show up in the morning, what do I have to get done today? And then the next day? What do I have to get done today? So planning ahead is something that I'm really not good at. And that's hurtful for me and for this balance and for my husband. So what I've done is I've made the concerted effort to schedule a week off every quarter. So that's 4 weeks off a year. I think I get actually more than that, but I make sure that I've scheduled 4 weeks off a year. Because I wasn't taking vacation. I wasn't taking my vacation because all of a sudden I'd be like, well, when are you going to take vacation? Well, I already had everything. My calendar was already booked. So there was never any vacation. All of a sudden 6 or 8 months would have gone by and I wouldn't have taken any vacation. So that's one step that I've done, is just at the beginning of the year, I just map it out. Here's when your time off is, block the calendar. And sometimes it has to move because unforeseen things come up, but usually we make that happen. And then my next thing is actually planning what we're going to do during those weeks. Because again, planning is not something I'm like thinking ahead and planning. So you can't, the week before you go somewhere, you can't say, okay, now where are we going to go? Like you have to figure out where you're going to go, what are you going to do during that time, and you have to actually plan it. And I think actually that helps my anticipation of like, oh, I'm going to get to go here and we're going to get to do that. So that's one step I've taken. And the scheduling out things on my calendar that I've said yes to, that's the other step I've taken to try to make sure that I'm not doing everything on Saturday and Sunday when I'm not on call.
Oh, I so second the vacation thing. I love traveling, and COVID definitely put a damper on that. But now that things have opened up, I love planning vacations, and I do map it out, a year in advance. What am I going to do?
Wow.
And one of the things I've noticed as now that my daughter, she's in college now and she's not local anymore, is to make a concerted effort to go away, just me and her. We're going away in 2 weeks and I can't wait. And when I get invited to conferences to speak or whatever that it may be, to tack on a couple of days on the end or on the beginning where I can, take an extra day and hang out in the hotel and, get a massage or whatever that it may be. So That's kind of how I've done that. Erica, I don't know it sounds like you do the same thing with vacations.
Yeah, I would say the key to success is always have something to look forward to. And so John and I we travel a lot, and I use every single day of my vacation because otherwise I could work 30 days straight in a sense. Because when you're in leadership, you never have a day off, right? You're getting a call about this, you get a call about that. And so to completely shut off, it means you cannot be in town. You have to be in another country or something else. And John and I we pack our schedule and we go to the other side of the world and we are not available. And it's the only way that I can really, truly recharge my battery, but also re-energize our marriage and our friendship and our playfulness and the things that are important to the wellness. And I say that having been a workaholic, and that didn't serve me well. Getting to professor at 8 years, I had a colon cancer,
Yeah.
So, I needed that to sort of create some balance in my life, and also to say my time is my time when I'm not. I have to physically separate myself from work.
I think that's really important.
And that takes planning. You can't just decide I'm going to go away this weekend.
Yeah.
It takes planning and thinking ahead, which is where my downfall was, and I've had to really work on.
Yeah.
I think it's very important because I do think burnout, we've read about it, we knew about it pre-pandemic, it became really amplified and compounded during the pandemic because we didn't take vacation. Why would I take a vacation day when I'm just going to stay at home? And didn't travel. And I think it was very hard. I gave a grand rounds this past week, and I titled it "The Pause is Power," and I stole that from the Powerade commercial that I actually happened to see during the Carolina Duke game, Kelly, in the semifinals. I went to Chapel Hill for that game.
Did you really?
Well, something I'd never do. My med school roommate from 30 years ago called and said, "You want to go to Chapel Hill?" I said, "Yeah, sure, why not?" And it was during that game that I saw the Powerade commercial and saw the T-shirts and the coolers that said "Pause is Power." And I went on and read about it, and it's really a campaign to amplify and encourage people, not just athletes, to take a pause. And whether your pause is for a couple months, which is actually what I'm doing now, I'm still practicing, but taking a little pause from administrative work, or your pause is on a weekend, or it's a Saturday afternoon, or it's you saying no, or it's you traveling, Erica, is that we all need that to re-energize ourselves, to recuperate, to have well-being. And so it really encourages people to be able to speak out and say, "I need a pause," whatever that amount of time is, because it is powerful. It is very powerful. So good for you all.
I'll add one thing. I really, really love my backyard. And I love, here in upstate New York, during the winter season, everything is like dark and black and not pretty. And then there's this spring that's a regrowth. And one of the things I encourage everybody, find a spot that you see every day, like in your home, that is sort of your little haven. And to me right now, my deck is. I love looking at my flowers. Even if I only have a minute just to stand outside for a second and take a deep breath, it makes just makes everything go away for that minute. Mm-hmm. So I found that to be very helpful too.
I would agree. And an investment in the future, whether it be in your garden or raising puppies or having kids or whatever it may be, it's kind of you're giving back to the world, and it's a good feeling, even if it's your herb garden or your koi pond or your puppies, whatever it may be.
I love Erica's puppies.
Yeah.
They gave us joy.
Yes. So one of the things my next question has to do with imposter syndrome. So before I gave my grand rounds last week, I had texted the person who had invited me, and she's one of our colleagues, much younger, and I said, "Just having a moment of imposter syndrome." And it was an email, and she emailed me back and says, "You can't have imposter syndrome." I'm like, "Yes, I can. I can still have imposter syndrome." It's, it gets, my moments of imposter syndrome, they get shorter as you get older and you've done it. But, I still have that sort of rear up every now and then. Do you all still experience imposter syndrome? And what would be your advice for mentors or mentees and mentors?
Oh my God. Well, you guys all know me. I'm not shy about it. I have horrible imposter syndrome. I mean, I have this fear that, they're going to figure out I don't know what I'm doing, any minute, But I think, the advice I would have is that we all have it. Nobody doesn't have it. Everybody feels that way. Everybody has those moments. Some hide it better than others, but it's normal. It's normal. So if you feel that sort of self-doubt, that's normal. You have to try to look at objective evidence. I mean, there's no way you're going to get accolades or, very simple. As a surgeon starting out in training, your patients survive, you get good outcomes. That's your evidence that you're good at what you do. So patients love you, bringing you gifts, hugging you. My patients all ask me, "How are your dogs doing? How's your mom?" That relationship that you have with patients, that's the evidence that you're good at what you do. You can't forget about that and remember the one person who was mad at you or the one time you had a bad outcome. Everybody has bad outcomes. So you have to get out of your own head a little bit and look at some of the objective evidence. And then also, look at how other people are doing. My outcomes are no different than my partner's outcomes. I'm as good, if not better, than all of them at doing this. And yes, they have things they do better than me, and I have things that I do better than them. And that's just reality. So you kind of have to get out of your own head a little bit with that. But I have it. I freely admit to it. I have it all the time.
I would say I don't have it with relationship to managing patients. but certainly in terms of leadership and what I'm doing as a leader. And I think it's more, sometimes you feel like, I mean, we're always chasing the next thing, right? You get to here and now what's next. And at some point you have to say, I am here. I've arrived. So embrace it. And I think that's been more my struggle, as to, you don't need to do anything more. Just be satisfied with what you have already and take it, enjoy it. So that's, I'd say, my struggle. And fortunately, I have some people supporting me with that. Because it's sort of like, I don't deserve to be in a place where life is so good. But we do. We worked really hard, right?
Yes.
Yeah, exactly. I agree. I think as you get more experience, I don't really have it with patient care so much anymore. I did when I was younger, when I was starting out. But I have it more with the, with the academic and the leadership things.
Right. Because you certainly are climbing up in that academic ladder that,
They didn't just...
It's taller and taller.
But the truth is, they don't just hand out promotions. You earn them, right? So you that's what you have to remember on those days when you are having that self-doubt, I think.
I think to add to that, one of the things that was hard for me is to realize when it's appropriate to ask for that, going from assistant professor to associate professor to full professor, and having good mentors around made a huge difference. And it's not always the mentors you expect or that you work with. And what I found in my world that really meant a lot were the female vascular surgeons out there that I reached out to. Ruth Bush, you're one of them. And Kellie, you as well. And Erica, watching you do what you've been doing. I mean, these are the things that give you the confidence. And I remember when I was associate professor at Albany Med, and Vivian Gatton called me, and she goes, "It's not time yet." I'm like, "What are you talking about?" "It's not time for full professor yet. I have a project for you. Let's work on it. And then next year we'll revisit." And she was the one that really said to me, "Okay, now you're ready." And to me, that has been really what I'm so grateful for. And it's the relationships that we've built by getting to know one another and being supportive of one another, even when we don't work directly with each other. And I think that's something that we as women do a hell of a lot better.
We do it really well. That's a good point. We do it very well. Kellie, you brought up and Erica alluded to, your climb. And so you've been nominated for SDS secretary. So we're not going to campaign live here.
No,
but
no campaigning.
No campaigning. But what advice would you have for younger persons who look at these positions that you've been nominated for and it's almost unachievable ever? What advice would you have for them? Getting started in professional medical organizations, getting involved. How did you get there? How did you get to this nomination? And congratulations, by the way.
Oh,
yes.
Thank you. Thank you very much. It's a huge honor to be nominated and to be on the ballot. I'm really excited about it. I think, so when I look back on my career, I don't believe that it's my career. I was one of those people in medical school. If I were in medical school now looking at me, I would think, oh, I'll never do that. So the first thing is to understand that it's not that I didn't set out believing this was where I was going to end up. I never thought about it in that manner. I think I just tried to take advantage of opportunities that came my way. And, when you're given an opportunity, then you perform and then you get more opportunities. And then if you say yes to those opportunities, you continue to perform. If you don't perform, if you don't do a good job, you're not going to get asked to do more. So you have to prioritize doing a good job. what I would say is, in terms of getting involved in organizations, or, professional organizations are volunteer organizations, and you need to volunteer. You need to show up and you need to volunteer. But then most professional organizations have more volunteers than they have positions. So the first time you volunteer, you're likely not going to get asked to do something. So I put my name in for an SBS committee. I can't tell you how many years in a row before I got one. I mean, many, more than one. I mean, like 6 years in a row before I got one. So I just kept putting my name in. Eventually, and people get to know who you are, and you get a reputation for somebody who gets the work done, and then you get an opportunity. I would say same thing for, in our world and the national scene, the Society for the Junior People when you're first starting out, which is a great opportunity, is usually the VESS, VESS. Mm-hmm. So that's a great organization for getting involved as a junior person in your first few years. And again, going to the meetings, presenting papers, volunteering, and networking and meeting people, and just, being a nice person. And then when you're asked to do something, you actually have to do it, and you have to do it on time, and you have to do it well, and you have to communicate. And so if you agree to do something, then do it. And if you can't do it, don't agree to do it. So that's what I would say, is just number one, volunteer. Number two, don't get discouraged if you're not picked the first time you volunteer, because there's always more volunteers than there are positions, and just keep volunteering. Don't be offended by that. Just keep volunteering. And number three, when you do get picked to do something, do it well, and do it on time.
Thank you.
And I would add to that, only sign up for something you want to do, because otherwise it becomes work.
Yeah.
So, sign up for things that you really want to be involved with. Mm-hmm. Because there's a lot of things that you could sign up for in every single surgical society, and some of them are boring. At least it would be. So pick what interests you.
Yeah, that's very true.
That is very true. Joanne Lohr once told many of us when I was much younger that you show up to every committee call. You dial in. Now we're on Zoom. Whether you're on your phone now or sitting in your car, pull over, don't drive. But she just said, show up. You have to show up. If you're going to volunteer, like you said, Kellie, you have to show up or resign your position. If it's become something, because we all have extenuating circumstances.
Absolutely.
And things happen that we didn't anticipate, and they happen to everyone. And I think that, as long as you communicate, you let somebody know. But that's very good advice. Very good advice. So we wish you the best, Dr. Brown.
Thank you.
Right. I would also say, though, that, the SBS and other, your ACS or ASA or whatever it is, it's not the end all. So if you choose to do other things within your community, that's okay. It doesn't mean you're a loser because you're not SBS president. No. You pick what's important to you.
Yeah.
And for some people, that's not important at all. Mm-hmm. And, so don't feel like if you're not on a committee or this or that, or you're not engaged, then that you're lesser of a leader or a person than anyone else. It's just find what interests you.
Couldn't agree more with that.
Yeah, I think it's very easy to say the grass is greener, or to compare yourself or what you've done and think, and that comes back to the imposter syndrome, right? Is to think that it's not as good, or it's not good enough.
Right.
And it is absolutely. So we just have a few more minutes. Is there one thing that, if you could give advice to younger persons or aspiring surgeons or academicians, Something that you would tell your little sister, that you would want her to avoid, if you will. Is there something?
Don't let the boys get you down.
Yeah, totally agree. Yeah, I can't tell you how many times I went to medical school at UT Southwestern. I had professors telling me that I can't be a surgeon because I'm a girl, and you can't raise a family and be a mom and have be a normal wife if you're a surgeon. And I remember smiling, saying, "Yes, sir." And then, literally when I was asking people for recommendation letters, and I hightailed it to New York City, figuring that they wouldn't treat me that way. And honestly, what I've always said to my daughter, even when she was 3 years old, stand up for yourself. Do what you want to do. And if somebody says you can't, smile and do it anyway.
Yeah, I think that's very true. I think that's true. We probably, all of us are of an age where I'm sure that we were told many, many times that we couldn't be a doctor.
Yeah.
We couldn't be a surgeon. We couldn't be an academic surgeon. We couldn't do what we wanted because we were a woman. And none of us believed it. And that's why we're here. And so you have to have a strong belief in yourself and your own abilities. And I would say avoid believing the naysayers. If you really believe in yourself, you can accomplish almost anything. So don't. So I came across somebody who told me a story once about they wanted to do something. They wanted to be a ballerina or something, and they were told no by one person, and so they derailed their dreams. They did something different. And somebody told them later in life, they were lamenting that they had done that. And they said, well, if one person telling you couldn't do it meant that you didn't do it, then you didn't believe strongly enough. So, how many people told you couldn't do it? It wasn't just one person. There's tons of people told us we couldn't do it, and we did it. So you can't let yourself get derailed by one person who's being, negative towards you. You have to have that belief in yourself, and you can do basically what you believe you can do.
I completely agree. And I've also learned over time to, ignore the naysayers. And as you said, don't let them get in your head. You put them over here because there's so many more people who are going to say, that's fabulous. That's great. You go, girl. And clearly they did, because we all did it and did well. So, well, I would like to thank you all for taking the time on a Saturday morning. Kellie Brown, Erica Mitchell, and Kathleen Ozsvath, I am so glad to call you colleagues, and I'm more thrilled and privileged to call you friends. And so I look forward to seeing you in the very near future. I would like to thank Dr. Kapnick and Dr. Kanata for the opportunity that EmPowHER has given us, and I'd like to thank our generous sponsors, Boston Scientific and Medtronic. So thank you, ladies, and I hope you all have a fabulous day.
Thank you.
Thank you.
Bye-bye.
Bye.